Welcome to Digital Health Talks. Each week, we meet with the healthcare leaders making an immeasurable difference in equity, access, and quality. Hear about what tech is worth investing in and what isn't as we focus on the innovations that deliver. Join Megan Antonelli, Janae Sharp, and Shahid Shah for a weekly no BS deep dive on what's really making an impact in healthcare.
Hi, everybody. Welcome to Digital Health Talks and Health Impact Live. This is Megan Antonelli, and I'm here with my friend and co-host, Janae Sharp. Hi, Janae. How are you?
I'm great. I'm thrilled to talk about good things today.
It is. There's been a lot of good things since we last chatted in September. I can't believe we're halfway through October.
Time is a construct, so I'm thrilled. I love October. I love pumpkin spice season. I love all things.
Yes. Were you at all impacted by the hurricanes in the last weeks?
Some of my people close to us were like 15 minutes away. They didn't have power still days later. And we've done some volunteer work cleaning up. And also my kids' school collected a bunch of donations and flew them out there. Other than that, I was pretty lucky. Like we had a power outage for a while, but nothing was destroyed except like a piece of our fence. So
good.
We got lucky.
And how's the weather now?
It's nice outside. It's perfect now. It's leaf season. So
nice. We don't really have that here. We don't really have leaves.
That must be rough. Being by the beach is always tough. And I feel for you.
I know it is hard. It is hard.
Yeah. I do think a lot about the people, that's really close to us. I have friends out there and there's just some devastating destruction, so thinking about all those people there and seeing how many people have volunteered to help has been wonderful.
Yeah, it is crazy to see what's gone on in Florida and in North Carolina. I have a friend in Asheville, so I think she actually left for Florida after the hurricane, and then Milton came to Florida. But luckily, she was in a safe spot. So
good.
But it is tough. It is hard. But like with here, it's like the earthquakes come, they go. Luckily we haven't had a big one, but you get the fires. There's always something.
Yeah.
Climate change is not on our list of good things.
No, and let's not talk about it. Just like we're not going to talk about politics today, because that's just a gift we're giving to our listeners.
I'm happy to do it, though.
Yeah.
But no,
one good thing is sometimes you can find things on your feed that aren't about those things.
Yeah, well, at least we should be talking about it probably, but it wouldn't fit into the good things conversation. So maybe another episode we can devote specifically to what we should be all doing in the next couple of weeks. But today is all about good things in digital health. So Janae, why don't you kick us off with the first one you found?
I found something interesting out of the University of Utah, funded by the National Institutes of Health, and they are looking at sensor and metadata for analytics and research in exposure health. So, everybody has some kind of device that's listening to their heart and measuring their sleep and judging them, or helping them become a better athlete. The University of Utah has a project, Smarter. It's called Smarter, which is sensors and metadata for analytics and research in exposure health.
They are really great at acronym development.
I would say they're just about as good at acronym development as they are at logos, but that's a different topic. You know what they are good at? Looking at large data sets and seeing how they combine. And I think it's an important thing because there's so many different types of devices, measurement devices, smart devices, like wearables. We got really excited about them. Everybody has a different one, and looking at how those data sets are actually being used to impact health is critical.
Mm-hmm.
Obviously I'm biased. Like I hope they're not just selling them.
So is the purpose to get data about the impact of exposure to sensor data, or is it to get data about the impact of having all of that data and what we then do with it when we are measuring and quantifying ourselves?
I think it's a measure of both because they're looking at the data sets and it's like a meta-analysis of that, but it's also looking at like exposure, like your
Interesting.
environmental exposure to contaminants, like could we learn something about Flint and the water contamination from your wearables data? Like, would we
Got
be
it.
able to have population level tracking? Um,
Got
or,
it. But it's not about exposure to the sensors themselves.
that's a great point because you know what? I know a lot of people that I'm Facebook friends with from high school who'd be like, well, maybe it's the sensors themselves that are causing bad things, and people who are like,
Right.
like, don't ever have your phone by your bed. Like,
Right.
this is
For various
something,
reasons. But no, it's super interesting. And I think anything that's looking at kind of the impact of all of this is interesting. We just talked about there was a
and
new
it's not just like sensors like for our bodies. It's also like stuff like the BioWatch system, stuff like, environmental things that aren't just individual.
got it. Got it. Well, we just saw that there is a new ring. Now I'm an Aura ring. I've had a couple
Yes.
of these, but we were just talking about there's a new ring called the Happy Ring that seems to measure most of the same things that the Aura Ring measures, but maybe it'll come out at a different price. It seems to be FDA approved for something as well,
Yes.
but it seems like we're going to have a lot of choices of
Yeah.
devices. And I really liked what you said about, we all need, there's some of us who grow up needing mood rings.
Yes, that's right. I feel like the great thing about this, and it's good that they have FDA approval saying that some of the data they're collecting is accurate. And I really think we got carried away. We were there with our Lisa Frank trapper keepers and our slap bracelets and our mood rings. And here we are a few years later with some money. And we're like, you know what we should do? Let's bring them back mood rings.
Are you saying that you did not have a Stevie Nicks trapper keeper and you had a Lisa Frank trapper keeper?
I did. Yeah. I was just that generation.
I see. I
I
see.
still actually have some Lisa Frank stickers that I feel passionate about that I got at Costco. So we won't go down the Lisa Frank rabbit hole, but
Got it.
people got, the people who loved mood rings and would go buy them for $5 with their best friend necklaces. These are the people who are now wearing Aura rings or the Happy Ring. And I'm glad that they're very concerned that the data they're collecting is accurate,
Yes.
and that market where, you get real-time feedback about your data, that's helped some people. It saved lives. It's also helped some people increase their anxiety and become more neurotic than ever.
Right. Right. Well, while it does all of those things for me, for sure, I don't trust it from an accuracy standpoint as much as I trust it from a baseline, right? So it's like, I don't know if the baseline is correct or not, but at least if there's a large variation, I feel like I do detect it. So,
Yeah.
But that being said, certainly having the goal of accuracy and having the FDA give it a stamp of approval is a good thing.
And let's talk more about money. Speaking of people having money now.
Great segue.
Yeah.
So the Peterson Health Institute released a survey, I think just this week, maybe earlier last week, about the state of digital health purchasing. And it sounds like there is a upswing and an increase in that, which is exciting to see. I suppose the proof will be in the pudding. Is the evidence there? Are the outcomes going to be positive? But both out of, I guess it was something like 60% of health plans have cited cost savings, and therefore, and 49% of health systems and 34% of employers agreed around the cost savings as their motivators for adoption.
Right. And I think some of that is when we're talking to healthcare leaders, they're saying we have goals for our people to attain the best health possible. And if we partner with other companies, with digital experts, it allows our force to go faster. And it's a way for them to accelerate their digital health maturity and most of their health, what's available for their people. And I loved that vision that a lot of people have where they're building something together. And it's great news for innovators in this space. It's also great news for patients and for health systems because they're going to be able to do more with those outside teams for less money than they would be able to do if everybody was doing it in-house. Speaking of investment, 2024 has been a massive year for investment in autoimmune disease.
Which is remarkable. We have so many friends working in that space. Like Feldman and remission.
Right. And it's also so important, especially because of the state of COVID has altered some of those things. And we don't really understand everything that's going to happen there. And this investment that would help people understand this market, I don't think people realize it. They've had a $1.7 billion invested already in 2024. It's set to be twice what it has been in previous years, the highest year ever. And some of those things mean we're going to have better things available in terms of drug development. And it's also part of that red hot, the article says it's a red hot market. So I kind of like that. From the obesity market, from medications. People are more excited.
Right. And I think we were going to save this for later, but I think it's a natural thing to talk about. There was a CDC study about sort of have we hit peak obesity because obesity is going down. So when you have, obviously there's been a huge amount of investment into GLP-1s, right? But at some point that's got to cap out. And autoimmune disease and obesity and chronic disease are all tied together in a complex and, interlocked web that very rarely do you have, not have comorbidities in those spaces. Right. So, it is interesting to see both that money is going into autoimmune disease and obesity, but that we are seeing numbers finally come down.
Right.
I mean, I think on the obesity side of, with the CDC, that the rate is no longer growing, right? Which is something we've seen in adults. I'm sad to say it doesn't say that it's not growing with kids, so it probably still is. But
who knows?
To see that those numbers have stabilized and,
and the CDC has come out and said, this is an epidemic. And the idea that what we're doing is working is kind of revolutionary. And I know in other areas, it's not improving. And, there are concerns people have had about the heavy costs of some of the medications for GLP-1s.
Right. And
insurers don't want to pay for them.
Right.
But the idea that as a population, those rates might be going down, that's going to mean a healthier group of people. We're going to pay less over time,
Right. And of course, we just heard from Dr. Groves. I mean, GLP-1s aren't the only tool to manage obesity. There are other, various health coaches and just other trends that are happening. And I think even, he mentioned, just the food, system in and of itself that they're gearing and leading towards healthier choices and trying to fix it. I mean, it's very easy to find areas where they're not, but there are some good movements and certainly the food as medicine movement and where things, some of these programs in the schools are taking hold.
Which is great.
Right. There's hope, I mean, and while GLP-1s do provide hope and are one more, tool in the toolkit, it is always going to be the need for both behavioral change and, healthier choices and accessibility to healthy food across, all socioeconomic levels.
Right. And I think some of that is the crux of it. We had these tools where you could get a coach who would help you with your health and all this other stuff. But were they accessible to everyone? So it's kind of nice to see insurance companies be more progressive about what they want to help with.
And that's what he was saying. Actually, the tool that they have for diabetes and management, is free. It is free to Aetna Banner members. So some of these, and I actually think that this is a live health coaching tool, but certainly a lot of the health coaches that do involve AI and, agents, which we've heard a lot of discussion about lately, will be more accessible and less expensive, and hopefully, as effective when combined with some of these other tools that are becoming available.
Yes. And having them be more accessible is great and improving people's health.
And speaking of money and female founders and all of the things that we love
here, all of those things.
Maven Clinic announced this month that they completed their $125 million Series F round. So that is great to see, a lot of success. We complain often on our show about lack of funding going
I just think we're excited about women.
Yes, well, going to female founders and women's health. And of course, Maven is both with Caroline Ryder and being a clinic for women. So it's great to see that is coming through, and that I think a lot of that funding is going for the expansion of their fertility and family building program. We won't use that as a segue to politics. We'll let it go.
We will not. We're going to talk about how women and families are going to have more options than ever before.
Yes,
and
which is important.
Globally, women's health is an issue, and especially, family building, fertility issues.
Right. Which are also important. So it's great to see. I think that round was led by the Stepstone Group. And
Speaking of women's health, let's talk about one of our other favorite topics, menopause.
My very favorite.
I'm not in menopause, but based on the people around me, I feel like I have heard a lot about it.
Not contagious, Janae.
It's not contagious, but the complaining is. Just kidding. Is that a good thing? I don't know.
But maybe. The good news in menopause is the M Factor documentary, which is coming out today. Today, you will be able to watch it on PBS, October 17th, for anyone who tunes in and doesn't listen to us live. And I'm sure it will be replayed.
We'll still be your friends.
And then available, which the interesting thing about this is that it is a CME accredited film documentary. So that's one of the first, which I love to see, because of course I worked on the CME accreditation of web programs a long time ago.
I love that.
So to see movies come through, or documentaries, but also on this topic, which is a favorite of mine. And I think it's meant to both educate, the general population, but obviously clinicians, who are often not aware of all the topics or all the symptoms.
Sadly, medicine has typically been a little bit behind in research and an understanding of women's health.
Yes.
And so that's the nicest way to say it.
Right. Indeed.
But just
the producers are Tamsin Fidal, Denise Pines, and Joanna LaMarca Matheson. So, a great group of really amazing women who have brought together some really good perspectives. So definitely tune in to that. We're excited to see it. I will give a shout out also to my friend Melissa Ashley and her event that's coming up, Women in Work, which is really about this very topic and how employers can make that a more, provide the benefits, provide the support that's needed. And of course, we talked a bit about that today with Lindsay Spark as well, in terms of, employers and what they're looking to do for their employees. So,
and I like that they're talking about empowering women to seek proper health care and to talk about, midlife. A lot of times women, after a certain age, they disappear. And when you're talking about costs, the Deloitte analysis showed that they're paying 20% more out of pocket, even with insurance. So, and excluding maternity care, it's 18% more. So, frankly, it's nice to see something where it's becoming a focus and
it's just, it's been so long overlooked. And the reality of life as a woman, and as I know this, as my kids are now, between 20 and 13, those were really hard times to work full time. As they get older, it's actually easier to work full time. So if the being able to take care of your health in that time and being welcomed into the workforce in that time, should be a high priority. And it is literally the opposite right now.
Right.
You see women exiting the workforce more than otherwise. So hopefully this will change things a bit.
We're losing a lot of people in the workforce. Speaking of the healthcare workforce, let's talk about one of my favorite things. Talking about how much I still like yoga, even though people in well-being don't. And I love mindfulness.
Yoga does get a bad rap, but it's
so weird. I don't understand. They don't get mad at you for whatever. I won't go crazy about that. And that's another good thing from today. We won't go down that rabbit hole.
I think the bad rap comes from the idea, and this goes back to the topic from before, that there's Band-Aids, right? And it doesn't treat the systemic problem. However, why are you picking on the world's best Band-Aid?
And also, there are two problems here,
Right.
And people.
But
the news is, just because we love mindfulness, Megan, has 800 Pilates neighbors, so you love it. But mindfulness meditation can be similar to an antidepressant for reducing anxiety symptoms. I did send this to my kids. I sent this to everyone I know. Mindfulness meditation regularly, it can be just as effective as an antidepressant. And it was Georgetown University Medical Center's Elizabeth Hogue, MD, who led that study.
So it wasn't the Department of Scientology, it was actual doctors.
Yeah. I would love to see what the Department of Scientology says about it, because wouldn't that be weird? Interesting.
Well, they just don't typically medication treatment or anything for mental health, right?
I don't know.
Oh, well, that's the whole.
I'm sure they love mindfulness. Or do they?
Yeah, maybe we should talk about politics instead.
I don't know enough about them.
You should move to LA and then you will.
I would. Yeah. If I lived there.
We can have another podcast about what religions Janae knows about and what religions Megan knows about.
Yeah, I feel it wouldn't necessarily align. Yeah.
No, and then we can talk about politics too.
Yes. And we wouldn't call it 5 good things, though. I'll tell you that for sure.
No, for
sure.
But
let's talk about this. I like that they did this and show kind of a different perspective, that the effectiveness of something with mindfulness-based stress reduction versus, in this case, it was Lexapro, escitalopram, in a randomized clinical trial. That's significant. It also shows, personalization for what people need. I think some of those, it's somewhat simplified, right? Because I have a kid with eosinophilic esophagitis, and we tried to figure out his food triggers for months and it didn't work, and the medication's working, right? So the choices that we have are more like your lifestyle, your personal preferences, but just seeing that we have more tools available to us is great news. And
right. And there's a complexity to all of this, certainly depression and anxiety. And it does look like they used a number of different scales to sort of measure that. And it was a randomized clinical trial. And so to see a medication go up against mindfulness meditation and have mindfulness meditation actually
do fine.
Do fine is great.
Right. The monks, least they had something going for them. It reminds me of the books. My kids and I have been listening to these books in the car on the way to school. We listen on Audible, and one of them was about the chapter today was about reducing anxiety, and they brought in some of these issues, and I thought it was amazing, both that I have to spend a million hours in the car and that my kids will listen to this stuff at 6 a.m. when I'm driving them to school.
Right, when they have no choice. So they're a captive audience. You can make them listen to whatever you want.
Maybe we should do mindfulness meditation. They could on the way,
Yes. Yes. Well, I just recently got back to yoga, and I've never been like someone who goes regularly, but I did go often, before the pandemic. But once COVID happened, I just couldn't quite mentally get myself back in the studio, It was just a little too crowded, a little too many people. And so I finally got my vaccine this time and went back. And I'm really happy about it. Other than this like twinge of pain in my hip, I'm great. It's great.
Yeah. You just need to go into where is the digital health app that insurance is paying for that gets us regular massages from someone that will come to our house. That's all we're asking for in the next month. When you can join us for 5 Good Things again, I bet it'll happen.
Maybe not.
We can get there. I feel like on the scale, I always view this like on the scale of like where we're at to like Star Trek or Gattaca, and how much data they're looking at, how much, they're judging our health, and we're getting closer.
Yes. Well, the needle is moving. I had a great conversation with Toby Edelman at Avishur today about how much progress we've seen in the last 15 years. So
it's been amazing.
It has been amazing. And certainly the combination of virtual health and AI has made, what's possible seem even feasible, because things are getting less expensive. And he even brought up the challenges of infrastructure and capacity and actual energy that we will have to deal with.
Actually, you mean because we're running so many AI programs that we might be destroying the world we live in? That's not a good thing. So we're not going to talk about that. Toby brought it up. You can go back to earlier in today to listen to that. Find it on healthimpactlive.com. You'll be able to find a lot of great resources. And
those are the challenges. But what's possible is the change and what's coming and the changes we've seen. So that's all good. And he had lots of great things to say. So I thank them all for joining us. And thank you, audience, for listening to another segment of 5 Good Things.
Yes, as always, we want to hear your good things. So make sure to tag us, share them with us, and we hope we can move together to create good things as well.
Yes. And that's Megan Antonelli and Janae Sharp signing off.
Thank you for joining us for this week's Health Impacts Digital Health Talk. Don't miss another podcast. Subscribe at digitalhealthtalks.com. And to join us at our next face-to-face event, visit healthimpactlive.com.